Hi, I'm Ron Lang, CEO of CalCPA's Group Insurance Trust. This is part of a series of short videos in which we'll try to explain some of the key elements of the Affordable Care Act, and most importantly, how it may affect you, your firm, and your customers. The first step in navigating ACA is to determine which set of rules to play under. For the most part, regulations are determined by size. So whether for yourself, your firm, or in counseling a client, sole proprietors are classified as individuals under ACA. They have no W-2 employees. If you have W-2 employees, even if they currently waive coverage, you are not a sole proprietor, you're a group. Small employers have between 2 and 49 employees. This rises to 100 in 2016. Large employers have over 50 full-time equivalent employees. Identifying whether you're a small group or large group is fundamental. Small employers do not have a mandate, tax, or penalty to provide coverage to their employees. A tax credit is available to some small employers, and we'll roll through that in a bit. Large employers, on the other hand, are subject to significant player pay penalties, as much as $3,000 per employee per year for noncompliance. Determining small or large can be very simple or complicated depending on the situation. Let's look at the simple cases. Average the monthly combined number of full-time, part-time, and seasonal employees for the preceding calendar year. If it is 49 or under, you're a small employer. If your average monthly full-time employees are 50 or more, you're large. Anything in between, you must do a full-time equivalent calculation. We cannot go into all the real-world scenarios here, but if you're around the threshold, review IRS 2012-58 for complete details on how to calculate full-time equivalent employees. Most CPAs are either sole proprietors or in small groups. This video covers small firms. Sole practitioners and large groups are covered in separate videos. So where do we start? Here's a timeline of where we've been and where this is all going. To date, ACA has extended dependent coverage to 26-year-olds, eliminated lifetime maximums, and mandated preventative services. But the most significant provisions become effective January 1st, 2014. The individual mandate, the exchanges, eliminating pre-existing condition restrictions, mandated benefits and plan designs, community rating for individuals and small groups, deductible out-of-pocket costs and rate restrictions, and numerous taxes and penalties on individuals, employers, and health plans all hit at once next January. Just before we recorded this video, it was announced that the large employer player pay requirements have been moved back a year. So while we don't know all of the implications of this delay right now, what we do know is that this legislation is still very fluid. In many states, this means big changes for small groups, but here in California, most of these regulations have been in place for many years. But we will still see significant disruptions in premium rates as the government imposes a new set of premium rating rules. The health insurance industry will most likely be blamed for any large increases, but the rule changes will be the primary culprit. Another change will be increased premiums for some groups because of mandated limits on deductible and out-of-pocket costs. Their costs will go up as they are forced to move into more expensive, lower deductible plans. If a small employer does not provide health insurance, their employees are required to purchase insurance on the individual market under what is known as the individual mandate. If you do not have health insurance in 2014, you will pay a tax on your individual return. The mandate is fairly straightforward. Obtain health insurance or pay the tax. The tax and individual premium subsidies are covered under our sole proprietor video. The small employer tax credit that began in tax year 2010 will be increased to a maximum of 50% of qualified employer premiums for 2014 and 2015. The credit expires at the end of 2015. A change to note for 2014, to qualify for the tax credit, a firm must purchase their health insurance through Covered California. What is Covered California? It's the name of California's Small Business Health Options Program or SHOP exchange. What is an exchange? It's nothing more than a marketplace, a place to comparison shop for health insurance plans. We'll be covering Covered California, no pun intended, in a future video in this series. Looking at the tax credit, given the low income thresholds, we believe very few CPAs and CPA firms will qualify. So let's focus on the coverage options available to small firms who do not qualify for tax credits. You have three sources for obtaining coverage. CalCPA's Group Insurance Trust. We've been insuring CPAs for over 50 years. This is a unique CalCPA membership benefit, especially important for 2014 and beyond. We offer a number of PPO and HSA plans. HSAs are very popular with CPA firms. Our rates have historically been very stable and offer good value to society members. The regular commercial market, Blue Shield, Cigna, Kaiser, will all provide policies to any group that apply. Currently, these carriers have been able to give up to a 10% premium discount to small groups for a variety of reasons. This will be eliminated in 2014, so small groups will all be rated the same. Firms that were receiving discounts will see their premiums increase accordingly. Covered California will have a subset of plans available from the regular market. All of the plans and carriers are not known at this recording. If you are not receiving a tax credit, you probably would not want to purchase through the exchange. As I mentioned above, with very few CPA firms qualifying for subsidies, the trust has decided not to offer plans through the exchange. It will be a mixed bag going into 2014. Many firms are going to have premiums moving up and down based on the rating methodology and the plan limitations we mentioned earlier. When shopping and evaluating plans, here are some tips. Overall, don't shop by the lowest price alone. Evaluate the provider network. Look for doctors and hospitals in your area. Many low-price plans are using what are called skinny networks, and many plans do not have statewide coverage. Just because the plan is Blue Shield, it does not mean it includes their entire panel of doctors. For example, many of the limited network plans in Los Angeles do not include UCLA or Cedars-Sinai Medical Center. I'll mention here that CalCPA ProtectPlus uses the Anthem Blue Cross full network of doctors and hospitals, so our members have access to the largest network of doctors and hospitals statewide. Number 2, the lower the premium cost, the less coverage. All plans provide catastrophic coverage, but evaluate the deductible, co-insurance, and maximum out-of-pocket costs carefully. It's the premium and total out-of-pocket costs that matter. Just looking at premium cost is like only evaluating pre-tax instead of after-tax, so pick the level of insurance that makes sense for your firm. As always, the Group Insurance Trust can be your source of information on healthcare reform. At over 20,000 pages of regulations and climbing, we can't review everything in the Affordable Care Act in this short time. For more complete details, please see our ebook, April 15th Will Look Like a Picnic, and the other videos in this series. Please feel free to contact us if you have any questions.